Alrighty. I'm just going to check a little lower. I have a similar arrangement right there at the T1. Now, because it's really difficult for me to lift the T1 equipment up, so basically as I have another vertebrae that's popping back at about T1. So it's going posterior towards the table. I don't have enough stuff to lift. Okay? So I'm going to make her do it for me. Lynn, what I want you to do is I want you to press both of your shoulders into the table and the top, the back of your head, pressing into the table.
All right.
And go. Boop.
Oh, cool.
2. And here it goes. And relax. Stop. Boop. Bingo. So what she did is she did this, and boom.
And you're right in there.
I'm right there. I'm just holding it. And what's happening is that she does that. She brings everything around it up. This is sort of sitting in the middle, and then bang, gravity does the work.
She's doing it.
Yeah, exactly. The gravity is doing the work for her. So it's nothing more than basically I'm using the structure of her skeletal structure around the spot to do the work.
Because that's I've always had problems with that. People who carry heavy backpacks
Yes.
or whatever, that's like...
Yes, and especially people who carry the really big hat on one shoulder that's towing stuff, and they do that.
So that's cool.
Yes, it does. Or the other thing is that you have the people who carry the large handbag where they tuck it under their arm and do like this with it. So, yep, that's another way you can work with that.
Question.
Yes, sir.
I don't think we have a neck here like that, but I've always had problems with like a turtle. Very...
I mean, people who have no neck.
Yeah.
Okay. Gotcha. The mafia neck.
Yeah, well, whatever. The neck where it's really hard to get, you know, it's hard to find the vertebrae or get anything really happening.
Okay. Let me show you another possible way to work with the. Let me show you another way I often work with the vertebrae when I have not enough space to sort of move this, or particularly if I have somebody whose neck is so kind of locked up, I just can't seem to get much movement with these guys all together.
Yeah.
I'm going to use a different lever. Okay, so what I'm going to do here is, let's say I have here's a nice juicy spot right here. I'm here on the side, I'm about C3. Okay. What I'm going to do is, use this other lever. Think of your shoulder releases, your anterior shoulder releases. Okay? Remember these guys?
Yeah.
Well, there's another thing you can do with these. Now, if I'm coming all the way over here, okay, the action here is going to be working in this vicinity. I'm sort of caving this area. But if I just sort of find my little magic spot, like that's the guy right there, this one? Yes. Okay, what happens here is I can use this guy and rudder it around.
Oh, yeah.
Until this guy, because remember, a lot of the muscles that connect to the neck also connect to the shoulder. The relationship between the shoulder and the neck is a guy standing on a tightrope with a balance beam. So it's difficult. Here we go.
That's sort of like a little bit of super spinatus, would you say, or not really?
Not really.
Okay.
If anything, I'm getting more scaling.
Okay.
Yeah. And so now.
So that really will open it up.
Yeah.
Now, what do you look for? Just juiciness? I mean, there's not going to be much changing in length or anything like that, right?
Oh, you start releasing these muscles doing this, and what happens is that, yeah, you will get more length.
More visual.
And also, the other thing to remember is that with somebody who's like this, part of that is probably coming from their upper two ribs. If your head is shrinking this way, it may also be the fact that your shoulders are coming up to meet your ears.
Okay.
Yeah, so like guys like this. Well, yeah.
I guess so,
Well, yeah, if you drop these, suddenly it's like magically you have some neck. So don't forget.
Work reversal.
Yeah, so work with it. So it doesn't have to start here. You might release some of the underwriting upper ribs, 1, 2, and 3. Check those guys out. And a little bit of work to the clavicle, and then boom, then start your neck work. because I've never seen anybody who was in that turtleneck position that didn't have elevated ribs.
Okay.
Uh-huh. So, quick, done enough for you guys to play with?
Can I just make sure I'm clear?
Sure.
So we get a feel for each vertebrae when we, just in general, like you're pushing them side to side of transverse processes.
Mm-hmm.
And then we go to each one to see if it, each specific one to see if it likes flexion or extension. Okay.
Let me start from the top.
Okay.
Okay. Be with the neck. Relax.
Mm-hmm.
Then pick one of the ways you want to check the neck. So check rotation or flexion extension or lateral flexion, and you're going to check it vertebrae by vertebrae. So the difference here is that you're going to work with individual vertebrae in the different ranges.
Mm-hmm.
Now you can stay at one vertebrae and do all the positions if you like,
Mm-hmm.
or you can do, as I did, is you can find the most mobile vertebrae in that range. If I say I started with rotation, I found the most mobile vertebrae, and I went and I worked with that first from its most comfortable position, and then I rechecked to see what the change was and how far it went down the pipe. If you need to, you do the same thing with other vertebrae that need to get a little bit more balance between the 2 points. That make sense? If it doesn't, say so now.
Well, I think I think I'm getting what you're saying about, like, you're at the vertebrae that is at its most comfortable.
Yes.
And I understand that you're pressing up from
Yes,
that
I am.
other vertebrae. I'm just talking when you're finding the spots to
Mhm.
go to.
Mm-hmm.
Is it, like, I just want to make sure I'm clear. So whatever you choose, whether it be lateral flexion, rotation,
Mhm.
extension, flexion, you're doing that each vertebrae.
Yes,
to
each
to
vertebrae.
check all of them and then see where the happiest vertebrae is and then work from there.
Mm-hmm.
Okay.
And then you can move up and down after you release the happiest one, which will act, in a sense, moving with the happiest vertebrae first acts as your general release.
Okay.
It will clear out a lot of stuff, so you don't have to do every vertebrae. It will free up sort of the guys that are driving the getaway car, and will give you the opportunity then to just sort of fine-tune a few guys that are stragglers in their various positions and work with them. Yep. So you'll actually be doing more efficient neck work, hopefully, unless it's a really complex neck pattern.
Can I add?
And Morel?
Because I looked at it. So you guys remember in the phase 4 class where you learn the general releases for the neck, right? So we check rotation, we
Press.
take it to the best place and we compress, etc., etc. When you do that, what you're really revealing is the preferred preference for 7 vertebrae working as a group, but that's very general, especially if there's one vertebra that needs the attention. So the beauty of what Gary is showing is if you check for those preferences at each segment, then you're going to be more precise in your neck work. You're going to help someone a lot more than if you're just engaging a very general pattern that involves a whole lot of stuff. Make sense?
And you're not holding this bowling ball in a flexi straw. Sir?
In your demo, you did the say rotation all the way down, find the preferred one.
Mm-hmm.
You did that,
Mm-hmm.
and then when you go flexion,
Mm-hmm.
Good.
Yep, I did.
It's like the same moves, but a little different reference.
Yeah, that's it. You're not referencing it and controlling everything from the top of the head to get down there. You're actually vertebrae by vertebrae, finding it, working with the compression from a very short distance instead of from a very long distance. So your compression is much easier for you to control because you're right next door.
Is this your discovery?
No.
This
General.
is my work.
This is her work.
Okay.
This is what you would learn if you took advanced spine and pelvis.
This, let me put it this way. This was what made my neck work elegant from the starting place I had. I thought Ortho-Bionomy neck work was elegant when I first learned it in my first phase 4 class with Morel. But when she showed me this became more elegant because I wasn't spending so much time balancing this object and trying to control it, called the noggin. Because what happens is a lot of times when you're doing that, if the client at all feels you don't have control, they're freezing up. Because what happens is that it's a very sensitive place. You have a lot of concentrated senses. So if you just at any point seem like you don't have control of that head, they just like boom. Here, you don't have to do a lot. You just go in vertebrae by vertebrae. Most of this, the head is resting on the table. It's very easy for you to do with control.
The only time I compress from the head is when I'm teaching a phase 4 class.
Yep.
Pretty much.
And
The
pretty
rest
much.
of the time, this is how I'm looking at it.
And pretty much, I'm the same way now.
Cool.
So, any more
So
questions?
play with my toy and see if you like it as much as I do.
Exactly.